All right, welcome to our final explainer in this three-part series on benign paroxysmal positional vertigo. Today, we're getting into the good stuff, the highly effective treatments you can do right at the bedside to actually cure this really common condition. So let me kick things off with a question for you. Of all the things you do in a week, which one intervention has an 85% cure rate for a problem that can otherwise drag on for months? Think about that for a second. What procedure could that be? Well, the answer is the Epley maneuver. It's a procedure that's totally free, takes about 5 minutes, and as you can see here, it has one of the absolute highest success rates in all of medicine. It's truly remarkable. Okay, here's the game plan. We're going to fly through these 6 key areas, and by the end, you'll have everything you need to confidently tackle BPPV in just one consultation. So first up, let's talk about why this isn't just another procedure you learn. Honestly, it's a genuine game changer. An intervention that can literally transform a patient's quality of life in an instant. I love this quote from our source material because it just nails it. A patient walks in dizzy, miserable, and they walk out cured, all because of a skill you have. No prescriptions, no referrals needed. It's an incredibly satisfying part of medicine. Okay, time for the main event. Let's really get into the nuts and bolts of the Epley maneuver. We're going to walk through this step by step, and we'll use the right posterior canal as our example. So the goal here is pure mechanics. We're just using gravity to shepherd those little misplaced crystals out of the canal and back home where they belong. But precision is absolutely everything. So step 1, have your patient sitting up and turn their head 45 degrees towards the bad side, in this case, the right. Step 2, quickly lie them back into that Dix-Hallpike position. You're going to hold them there for at least 30 seconds, maybe up to a minute, until the vertigo stops. Okay, step 3. Smoothly rotate their head a full 90 degrees the other way, toward the left shoulder. And again, hold for 30 to 60 seconds. Then, for step 4, you'll have the patient roll onto their left shoulder so their face is pointing down toward the floor. Hold it. And finally, step 5, help them sit back up, keeping their head turned, and then gently bring it back to the center. And of course, you just mirror this whole dance for the left side if that's where the problem is. Great. So you've done the maneuver, but what you do next is just as critical. Setting the right expectations and giving crystal clear advice is key to locking in that success. And look, the numbers here really do tell the story. A single, well-done Epley is going to work for the vast majority of patients. But what if they're still a bit symptomatic? Well, bringing them back for a second treatment boost that success rate to over 95%. That's just fantastic. Now, this is a really big one, a huge piece of advice for your patient. You know, the old advice was to have them sleep sitting up or avoid lying on one side. We now know from good evidence that that's just not necessary. Tell them to get back to their normal activities. And just as important as what to do is what not to do. And when it comes to BPV, this is a biggie. Avoid the vestibular suppressants. It's time to put that prescription pad away. Yeah, these drugs, they're just not the answer for BPPV. They don't treat the root cause, the mechanical problem. All they do is mask the symptoms, which can actually slow down the brain's ability to adapt. And really importantly, they can significantly increase the risk of falls, especially in our older patients. Okay, so what if the Dix-Hallpike is negative, but everything in the history is just screaming BPV? Well, you've got to start thinking about the lateral canal. It's the second most common type, and you need to know how to handle it. Right, so for the lateral canal, the Epley is not your tool. You'll need something different. Your first choice is the Gufoni maneuver. It works for both types of lateral canal BPPV and has a really solid success rate. The barbeque roll is another effective option, especially for the geotropic kind. I'd really recommend you look up some videos of these maneuvers to get comfortable with them. Now, you're going to be able to handle most of these cases yourself, for sure, but it's absolutely vital to know when to call in the experts. Recognizing the referral triggers is a key part of good management. This flowchart is a fantastic map of the whole process, from that first patient conversation all the way through to follow-up. But let's zoom in on the important part. What are the specific red flags that tell you it's time to refer? So here are your big red flags. You should refer if you've tried the Epley twice and it hasn't worked, if the BPPV just keeps coming back, or if you see any weird nystagmus, like a downbeating pattern. And of course, any hint of a central cause, BPV in a child, or that lingering unsteadiness that just won't go away, all of those need a specialist's eye. And just like that, we're ready to wrap things up. Across these 3 short explainers, we've gone from the history to diagnosis all the way to treatment. You've now got the complete BPV management toolkit.
Look, if you walk away from this whole series with just 4 things locked in your brain, make it these 4. Get these right, and you will absolutely transform how you manage dizzy patients.
The bottom line is you now have the complete, evidence-based package. You can go into any consultation with a dizzy patient feeling confident that you can effectively manage the most common cause of vertigo right there in your office. And I want to leave you with this final thought. For our older patients, BPPV is a huge, and more importantly, a modifiable risk factor for falls. So when you master this 5-minute skill, you're not just stopping the spins. You're preventing fractures, you're preserving independence, and you're truly changing lives. Hey, thank you so much for joining us for this series. For more great resources for both clinicians and patients, please do check out the Australian Dizziness Clinic's website.